So now we start to talk about the sacroiliacal joint region, which is usually one of the main problems with low back pain. And before we check once more if our pelvis is relaxed after what we have done up to now in our workshop, and you can see everything is symmetric, very good. So we can start with our work. And we start with our work in the center of the pelvis. Usually when there is a tension in the ilium psoas on the left side, the left ilium is rotated anterior, and the tension in the adductors on the right side are connected with the rotation backward. So we have, with the typical situation of the tension in the left ilium psoas and right adductors, we have this movement. Right side goes backward, left side comes anterior, and so we have a right shift of the pelvis, which is connected with the shift of the whole body. So the whole body goes into the right direction until up the shoulders, and then the upper region of the spine usually goes in the other direction to have our eyes straight forward. And this torsion also goes down to the feet, and we have this torsion in this way usually, which can be connected with all kinds of problems which are together with the spine, mostly with low back pain. So at the beginning is this joint between the two os pubis, the symphysis, and then we go to the sacroiliacal joint between the spine and the pelvis. And you see if there is a pressure in this region, we ask which direction gives the release of the pressure, this direction or this direction? So once we know the direction, we can hold the pelvis in this direction. So just hold it, and which is interesting right now is just the opposite direction of the most common torsion of the pelvis, which gives us the idea that there must be some problems inside the pelvis, which makes the opposite direction as the easier direction. Usually it's just the other way around. But we follow the direction the body wants at this moment. So you just hold it and observe the reaction of your body. So that's the first step.
So we have a relief of the gluteus on the right side.
The right gluteus is relaxing, okay. Okay, that's the first joint we watch. Then we have two very important points, which are at the bone, the iliacal bone. Is one of this painful? This two? This two?
Yes.
This more. So for this, it's a very good exercise. We can do it every day at home, just to press our knee downward. I will go with my finger here, and do you feel my finger less now? Just hold it. You can also put some towel or whatever over your knee and put on both sides. This gives a relaxation of the anterior fascial change, which goes up to the jaw on the left side from the feet, which crosses the abdomen and goes to the other side. You can do that every day. Okay, and when the big deep breath comes, it shows the valgus is free again. And it's good to do it on both sides. Okay. And the chain, the myotendinous change starts at the feet. Look at this point. Is it painful here? What direction do you prefer? Downward or upward?
Upward.
And we look at the second point, which is important. Is it painful here?
Yes.
And what do you prefer? Upward or downward?
Downward.
Okay. So we put something between the surface of the bed, and we hold this one upward and this one downward. So we relax now the chain which starts here and the chain which passes here. And these are also both are the most important acupuncture point. The spleen 4 and into 61. It's painful here?
No.
In most cases on the right side you have more tension. But if it's painful here, I would also try either downward or upward, or pressing or going upward.
This is nice.
Upward, downward, or upward.
Downward.
Oh, so this one is usually downward and this one wants to pull, but this is a torsion to the right. So we see the pelvis has a different way to turn than the feet. So then we must check why. Just hold it for a while. And it opens the chains, the myotendinous change, and also the acupuncture meridians. What do you feel?
It's beautiful.
It's beautiful. Okay, enjoy it. Okay. Next important point. Is it painful here?
Yes.
And what do you prefer, when I push downward or upward?
Downward.
And is it painful here?
Yes.
What do you prefer, downward or upward?
Upward.
Okay, so we said downward, upward, that's right?
Mm-hmm.
So we're at the knee joint and at the head of the fibula. It's good exercise also for knee problems. But it opens also the chain which goes then to the sacroiliacal joint.
I feel a little bit of nausea. I feel a little bit of nausea with the outside point.
Nausea, so you do it a little less with less pressure. If you feel something which is not comfortable, we lessen the pressure.
It's better.
Better now? Okay. It's better now?
Yeah.
Okay. We would do that on this side maybe too, but it's not so necessary right now. Now please turn on the stomach. I'll give you some paper here. So now we go to the sacroiliacal joint. We start with the left one. You feel my fingers here?
Yes.
And do you feel them less if I go downward or backward?
Backward.
Okay, on the right side, which is more comfortable? Downward or backward?
Downward.
So that's the same direction we have noticed working on the symphysis. This one goes backward and this one downward, which is just opposite to the usual torsion of the pelvis and also opposite to the torsion we had on the feet. You can lift your feet, please. Okay. And how do you feel with this movement?
is pleasant. Pleasant, it's pleasant.
So it gives a relaxation. And now we add the sacrum. Which direction of the sacrum is more comfortable? Upward or downward?
It's the same.
This is downward, which gives a deep breathe.
Downwards.
Downward. Downward gives a deep breathe and relaxation, so it activates the vagus. So we know this, and we want to check also the coccygeal point. Is it painful here?
Yes.
So we push the ilium downward, the sacrum downward, and the coccygeal downward. Is it
Yes,
comfortable now?
Yes.
This last point is one of the most important points when the stress is in the body. It shows that our vagus is blocked, and usually it's the dorsal vagus, which, because we have a net of parasympathetic nerves in the sacrum area, which are connected with the vagus in the upper stomach. And so if you have some overwhelming stress, usually we have a sign for that here in the pain of the coccyx. And we cannot achieve a relaxation if this point still is painful. So whatever we do, we have to include the dorsal vagus with this coccygeal point. And often this point needs time. Doesn't relax directly. Often we have this tension for years, maybe since childhood or our birth or whatever. Whenever we had overwhelming stress. Of course, also traumatic stress, like falling just on our spine on this point, gives the tension here. And we hold it, and we want to see if it can give a relaxation by itself, or we have to do something else. And if by holding it, the body doesn't let loose, but she's starting to shiver, so some reaction is passing. And now we help the relaxation with our imagination. Can you imagine that I push the sacrum deeper inside your pelvis? Just imagine it. And I imagine it too. Okay, now imagine the opposite direction, as if I would push the sacrum upward. Just imagine it. Now it releases. So now the finger gets close. Do you feel the change?
Yes.
In the moment that she imagined that the sacrum goes downward, the coccyx could release. And that explains also why the torsion of the pelvis was in the opposite way. Because inside the sacrum had also two directions. The energetic direction was upward, and the anatomical direction was downward. And now you feel something has happened. Like a very big, long, old burden has relaxed now. And we feel the emotions also coming up. And we can add also a little relaxation by holding the aura of the sacrum. And you can let your both arms fall down so that the energy also can sink into the earth. So just let the energy get out of your body and watch the emotions. Okay. So thank you very much. I would go on with the video with another client because you need now little time for resting. Okay? Thank you.